Today, we are delighted to launch the online Scorecard Maturity tool. Over 40 African countries are using country scorecards to track progress on malaria, reproductive, maternal, newborn, child, and adolescent health, neglected tropical diseases, nutrition, and community health. The use of the scorecard tool has led to significant action and impact, with countries using real-time data to respond to outbreaks, to respond to shortages of staff, to respond to shortages of commodities, and to improve the quality of care. Scorecard tools have also facilitated increased financing and increased political and multi-sectoral engagement in health.
Through our years of supporting countries introduce and improve their scorecards, we have discovered that scorecards have the most impact when they are integrated into existing national and subnational processes to enhance sustainability and drive action, shared widely to a range of stakeholders from national leaders to members of the community for increased accountability, and decentralized subnationally down to district or facility levels and used in communities to identify bottlenecks, make recommendations, and track action. With this in mind, we developed the Scorecard Maturity framework to assess the use of the tool across 5 key success factors. 1, use as a management tool. 2, decentralization. 3, public sharing and dissemination of the scorecard. 4, institutionalization in existing accountability mechanisms and political use. And lastly, documentation of best practice and evaluation of the scorecard.
The Scorecard Maturity tool follows the country journey towards institutionalization. As countries graduate across these 5 areas, their scorecards are used more effectively to identify bottlenecks, drive action, and ensure impact. A scorecard tool is considered to be institutionalized when 1. The scorecard tool is used to implement key policy changes or track key activities. The scorecard tool is used to respond or prepare to epidemics. For example, during the global COVID-19 pandemic, several countries reported using the scorecard tool to monitor service continuity. The scorecard tool is also shared with high-level actors, such as in a parliamentary forum or with multi-sectoral forums like an End Malaria Council. Best practices are also documented and shared internationally. The scorecard tool is shared publicly, for example, published on a government website every quarter or on the Scorecard Hub. And data are widely improved and data audits are regularly conducted. Of course, all countries will use the scorecard differently and can tailor the tool to their needs, but the Scorecard Maturity Framework provides countries with general guidelines and best practices to follow, recognizing that no one size fits all.
To help even more countries benefit from the framework, we are launching the Scorecard Maturity self-assessment tool, providing countries with a simple and accessible way to use the Scorecard Maturity framework and improve their scorecard. The new self-assessment tool helps countries assess their scorecard, understand where their scorecard is performing well and where it can make further progress, access a list of curated recommended improvements, and learn from the successes of other countries. It is a simple online tool that works on computers, laptops, tablets, and smartphones with a web browser and an internet connection. So let's delve into the tool. So the first step is to go to the Scorecard Maturity self-assessment tool on the Scorecard Hub at www.scorecardhub.org/maturity-framework. There is also a link to the self-assessment tool directly from the Scorecard Hub homepage, and we'll be sharing a link in the Zoom chat too. After this, you just need to answer a set of questions. It should only take you around 10 minutes to complete. With the first few questions, we ask about the specific scorecard you are assessing, including whether it is a malaria, an RMNCAH, an NTD, community or nutrition scorecard, and whether you use the Scorecard web platform to manage the scorecard. After that, there are a set of multiple choice questions for you to answer. These questions are divided across 5 pages, 1 page for each of the 5 key success factors. After you have answered all of the questions, you will receive a maturity score and a curated list of recommended improvements. Based on your overall score, the tool will assess the level of maturity of your country's scorecard. To help you improve your scorecard, and in addition to the score, we provide a set of curated recommendations to improve your scorecard based on our years of experience supporting countries with scorecards. They will include links to helpful guides, best practices, and online courses on the Scorecard Hub. You can view all of the recommendations right from your browser or download a PDF version for sharing with your colleagues and viewing offline. So that is the Scorecard Maturity Self-Assessment Tool, available on the ALMA Scorecard Hub, and providing countries with a simple and accessible way to use the Scorecard Maturity Framework and improve their scorecard. My colleagues will now share with you some examples from across Africa.
The Scorecard Maturity tool has helped countries institutionalize scorecard tools for management and accountability. Zambia, for example, has become a global best practice in its use of the Zambia Malaria Scorecard tool to help support the ambitious goal of eliminating malaria. The scorecard was first rolled in 2016, and in 2018, Zambia decentralized the scorecard. Thousands of stakeholders were trained on the Scorecard web platform. Today, the use of a scorecard management tool is institutionalized in Zambia's malaria accountability mechanisms. The work plan is discussed at several meetings, including weekly management meetings at the national and sub-national levels. The scorecard is also discussed at several high-level fora, such as the End Malaria Council.
The Kenya scorecard is also a good example of how a scorecard tool gets institutionalized in decision-making at all levels. In Kenya, counties are actually using the scorecard in support of evidence-informed decision-making and timely responses to service gaps and bottlenecks that are identified within the counties.
The Scorecard Maturity tool is also useful in the sharing of best practices and highlighting successes that other countries can learn from. One such example can be found with the Mali RMNCAH scorecard. In 2020, when COVID-19 struck, many countries observed huge disruption in the delivery of essential health services. Mali used the scorecard process not just to track the disruption, but also to inform development of mitigation plans to ensure communities continue to access healthcare services.
In Uganda, the scorecard is a standing agenda item in quarterly district review meetings, which are led by the district health management teams. The scorecard is also used to better engage and serve communities. Its findings focus community systems, and the scorecard is also discussed with communities for joint problem solving of underperforming indicators.
An improved scorecard helps to drive increased accountability and action, and ultimately deliver better health outcomes for all citizens. I encourage all countries to use the Scorecard Maturity Framework and self-assess to drive accountability and to improve healthcare delivery in their communities. Better health and better well-being means better economies and more economic growth. Thank you.